Welcome back to Arise Africa. And now for the rest of the program. As Nigeria experiences a steady increase in the number of confirmed cases, Lagos State, like other parts of the country, is taking proactive steps to curtail the spread of the coronavirus. The country has since instituted movement restrictions and lockdowns to adequately respond to the pandemic. And joining me now to discuss this and the government's response to the pandemic so far is a former Lagos State governorship candidate, Babatunde Gbadamosi. Good to have you join me on the program. Now, let me quickly start by asking for your take on the Lagos State government and their response in the handling of COVID-19 here in the state.
So far, I think Lagos State government has done relatively well. All things considered. In terms of the strategy that they've employed, there has been quite a lot of energy expended on making sure that that strategy works. However, I'm not entirely sure that the strategy they've employed is the best. I think that it's missing one component, and that is the component of pharmacological curatives, like the hydroxychloroquine therapy, which I've kept talking about. I started talking about it on your station. And there's also the Madagascar cure, and there's Professor Morrissey's cure, and there's also the monastery at Ewu in Edo State. I think these things, perhaps we didn't pay enough attention to them as the richest and most popular state in Nigeria. I think we should have been leading the charge in that regard. I believe that because of the way we led the charge in the Ebola crisis, we should have also led the charge globally on this one. But strategy-wise, I'm not sure that we had the right strategy from the get-go.
All right. Now, I wanted to clarify if you're in support of the current 8 p.m. to 6 a.m. curfew. And do you think it actually has any effect in actually curbing the spread of the virus as opposed to the typical lockdown with no curfews whatsoever?
I'm not so sure about the curfew because, what we should be focusing on is citizen education. I think that there is perhaps too much emphasis on enforcement as opposed to persuasion. I think the National Orientation Agency would have played a big role in this, and in their absence, the Lagos State Ministry of Information could have picked up the slack, in Lagos at least, to educate the people to the point that we did during the Ebola crisis. Okay? During the Ebola crisis, it was people that took responsibility for their own health. Everybody knew what the risks were because you could not escape Ebola information anywhere you went, and any station you listened to, any TV station you watched. You had it everywhere. It was always in your face. In this particular case, information is scarce, actual information about how this virus works, how it spreads, and so on like that. It's not quite as suffused as it was during the Ebola campaign.
All right, then, let me then ask you, how you think information should be made readily available to the public if you think at the moment it's scarce.
I think that, interestingly enough, we ran a campaign, we campaigned for elections just over a year ago. And we saw how to campaign, how to spread information about ourselves. We could do this. We could employ the same platforms to, spread information about this coronavirus to everybody in every language. Meet people where they are on every platform. Okay, in the marketplace, leaflets, everything. We should have been doing this, and we should have continued to do it so that by maybe week 3 or 4, nobody will be able to plausibly say that they don't know anything about the coronavirus and how it spreads. And also, I think that it was necessary with the Ebola virus. We saw images, stark images were spread all over the place of how, this thing affects the victims. And I think that has been absent in this particular case. Okay, yes, we want people to obey, but we should want them to obey voluntarily. Okay, we should want them to even suggest things to do that will help prevent the spread of this virus. I think that's what's missing. Citizen buy-in, that's missing. There's a lot of emphasis on force. Police all over the place, government officials charging into hotels and places of worship and all the kind of. It just doesn't look right. Okay, it doesn't feel right to the people, and that's why you see there's a lot of people roaming around the streets in Lagos when there's supposed to be a lockdown, 1 million boys and all that.
Okay. Do you think the gentle approach, though, would work in a place like Lagos?
The gentle approach worked during the Ebola virus, my brother. It worked. Okay, because there was information. Okay, there was solid information spread around everywhere. It penetrated everywhere, and it was always in your face. Wherever you went, you saw information about the Ebola virus, so people could not ignore it.
All right, then. Moving on to other things now, I want to gauge your thoughts because you mentioned the Madagascan remedy, and I wanted to gauge your thoughts on that. If you think it should be considered as an alternative option, particularly with the high numbers here in Lagos.
Well, I'd be interested to see, first of all, how many people are dying of malaria in Lagos, how many people are dying of dysentery in Lagos, how many people are dying of cholera in Lagos, and how many people are dying of Lassa fever in Lagos. There appears to be perhaps, a hysterical approach to this virus, where there should be calm heads. Okay, and it's the whole behavior of government around it that's making it look like it's more than it is. The Madagascan solution should be looked into. It should be examined. It should be tested clinically, okay, as quickly as possible. We have to take it the way government is taking it. We have to take it as if we're in a wartime situation. We're in a battlefield, and we have to look for the best alternatives that we can find as quickly as possible. So if the Madagascan therapy is as good as it's alleged to be, then we should test it. We should test it along with all of the other remedies that have been proposed.
How do you think Nigerians are coping, with the spread of the coronavirus, particularly here in Lagos as well? Because given all that you said with regards to the government, you've said the government should do this, the government should do that, the administration should do this, the administration should do that. But what about the people? Where do you think they should come in, and what do you think they should be doing?
Okay. This is, again, I need to be clear on this. I'm not saying that the government is not doing well. They are. But within the limits of the strategy they've employed. I need to make that clear. There's clearly a lot of energy in government. There's a lot of endeavor. Okay, people are working the hardest they can under the circumstances, from the governor down all the way. Everybody is doing their best, but within the strategy that they've employed. All I'm saying is we should expand the strategy a bit more, introduce more elements to it, and I think that then we will begin to see a drop in the number of infections. That's number one. In terms of the people's responsibility, I think everybody knows that they don't want to die. That's the most important thing at this point. And we should spread that information that, look, you could die if you catch this. It's not a death sentence, that's for sure. But you can't tell who's going to die and who's not. So it's best to just avoid it as best as possible. Stay away from it. We need to put human faces to the people that have been lost. And I think if we start doing that, if we start pointing out that, oh, so-and-so caught it and they're dead now. So-and-so caught it and they're dead now. We need to perhaps, people will call it fear-mongering, but, these are facts. This is real data. The chief of staff to the president died of coronavirus, and that's something that perhaps we should make more we should focus more attention on, so that people recognize that this is a disease that doesn't know office and doesn't know status.
And I totally get exactly where you're coming from, but like you said, don't you think that would create more panic as opposed to,
I'm not so sure about panic. I mean, we saw pictures of people dying in the streets in Sierra Leone, Liberia, and so on. People didn't panic because government informed them and said, look, yes, these people are dying, but the reason they're dying is because this was not done. If we do this here, then we will avoid those sins in this country. And that's exactly what happened. Thank God for Dr. Stella Ameyo Adadevo, the late Dr. Stella Ameyo Adadevo, who basically stood as a firewall between Ebola virus and Nigeria by locking down Sawyer, the Liberian, at her hospital. But after all said and done, Nigerians still paid attention to their health. They paid attention to all the suggestions that were made by government as far as personal hygiene, observing social distancing, what we're calling social distancing now. They simply said, keep your distance. If you observe anybody coughing, keep your distance. If anybody falls down in your presence, keep your distance, call the medical authorities. And it worked. It helped keep the Ebola virus, which I think perhaps was maybe even more contagious than the coronavirus. But the only difference was that the vector area where it started from was not an area that had high international flight traffic. If it had started from somewhere like China, it would have been a pandemic. It would have been a global pandemic, just like coronavirus is. But it was a localized pandemic in that it stayed only in West Africa.
Now, earlier on, when I asked you about, the Lagos state government, you talked about, some of the good aspects that they've done. But you also mentioned that they need to expand some of their strategies more. And I think you talked about some of those strategies earlier, the pharmacological curatives. You talked about the Madagascan cure and the monastery in Edo State. Are there any other aspects that you think Lagos state should be getting themselves more involved with in terms of the strategy that you think they should be expanding more on?
I think we need to lock down the borders of Lagos State. Okay, all our boundaries need to be shut. We need to prevent people from coming in from high-risk areas. And we know what's happening in the country right now. Busloads and trucks of so-called Almajiri coming in from Kano, which is known to be a high mortality rate state. Okay, because we're not actually testing enough. We don't know how many people are infected in Lagos State. So that's another angle that needs to be looked at. We need to pour resources into testing. The idea that each test is costing us 50,000 naira doesn't make sense to me. Okay, we need to look for cheaper and cheaper tests. There's a there's a $10 South Korean antigen test, and now there's a $1 test apparently that's been promoted in England and not in the UK, and also in Senegal. I'm not sure whether the two are the same because the Senegalese solution apparently was funded by the UK. So it may well be that what they're talking about in the UK now is what they discovered in Senegal. But be that as it may, I think Lagos State government can get in front of this, jump into this $1 test situation financially, and Lagosians can benefit from that.
Now, just before we wrap up, and on a totally, well, I think we're actually out of time. I was going to ask you about something else, but we're completely out of time. Thank you so much for shedding more light and giving us your thoughts. Babatunde Gbadamosi, thank you very much indeed.